welcome back to our Thursday True Health series, and we are now on our module 3. So, for those who haven't, who were not able to get their copy of the guide, please kindly directly message Coach Nixie so she can give you the link and the password to the guide. So, for this evening, our topic will be understanding the need for supplementation, knowing the history of supplementation, how it came to be, its importance, how it is regulated by the government, and how can we choose properly the right kind of supplement for us. Because the challenge of people today is that a lot of people really are interested in taking nutritional supplementation. It's just that one, may mga kumbaga parang dilemma, no? And usually the hesitation of people when it comes to supplementation is not because they don't want from our two previous modules. Doon sa mga naka-on ng webcam, I'm really requesting everyone if you can turn on your webcam, lalo na kung medyo malakas yung naman yung inyong internet, kindly turn it on so I could monitor yung reaction nyo, if you are following, am I too fast? Nasa-segue ko ba masyado para ma-assess ko lang yung pace natin. So, recap from the previous two trainings. Can you see the board? Yung mga naka-up close, okay naman, nababasa naman siya. Okay, so let's start. So, from the past two modules, we have always emphasized the word longevity. So, longevity is basically aging, keeping yourself young as you age. That is basically our goal. Yun ang goal natin lahat. So, kanina nga nakakatuwa kasi, nag-update sa akin si Coach Nixie and she sent me some pictures from Boracay. Nakakabilib because her mom, Tita Wilma, at 67 years old is parasailing, banana boat riding. Super na-enjoy niya yung activities sa Boracay. She's a perfect example of what longevity is all about. That we can reach that 67 years old and still be able to do what a 17 years old can do. Yun yung goal natin. So how does the body achieve longevity? So, basically, when we say longevity, it covers three things. First is lifespan. Lifespan is yung number of years na nabubuhay ka. So, depende yun sa'yo, case-to-case basis. May mga tao gusto nila, happy na sila sa 50. Meron gusto, happy na sila sa 60. No? Ako dati, happy na ako kung marating ko yung 45. Bakit 45? My mom died at 45 years old. My mom, who was a doctor, died at 45 years old. So ako growing up, especially being an adult and following her footsteps into medicine, parang na-embed sa subconscious ko na pag na-reach ko, malagpasan ko yung 45, okay na ako. Kasi narating ko yung narating niya. Parang may ganun akong thinking. But over the past 10, 15 years of learning about wellness, no, and how to take charge of our body, especially our health, I learned to appreciate na we dictate our lifespan. No, hindi naman kailangan na meron tayong kumbaga, anong tawag doon, expiration date. Hindi kailangan ng expiration date. Kasi pag-aaralin natin yung katawan natin, there is no set expiration date. It's up to us, no? Up to when and yung quality. So lifespan is the length, number of years you live. But the question is, how is your health span? So health span is the number of years you live healthy. So, this is our goal. Ayaw natin yung tumatanda ng may sakit. Kasi pwede naman tayong tumanda ng healthy. Again, perfect example, kaway-kaway, nandyan si Tita Wilma. Maganda siyang example talaga. Okay? And then, the third component of longevity is healthy aging. Meaning, luma na yung konsepto na habang tumatanda ka, rumurupok ang katawan. Yun yung isang mindset or belief system na kailangan natin baguhin. No? Yes, there is a natural aging process to your body, but this is something that can be delayed, and the breakdown of the body as you age is something that can be prevented. So for example, if you're 30 years old and lumalabo na yung mata mo, aba, Ask yourself, what are you doing? Meron kang hindi nagagawa. So how can we achieve this longevity? We have in our DNA, it is encoded, we call it the longevity genes. No, naalala yung lesson natin in Module 2, lahat ng tao, meron itong codes na to. So in short, lahat tayo, meron tayong kakayahan maging young as we age because we all have this longevity codes. Pero ang issue, itong mga longevity codes na to, nakalock. So di ba, na dati discuss natin, yung chromosome is like the library, the DNA is your books, the codes are the instruction in your DNA. So imagine your library closed. So wala kang access dun sa mga libro na yon. Dahil hindi mo mabuksan yung library, hindi mo mabasa yung instruction for longevity. So nakalock siya. But experts have shown in their studies that these genes pala, pwede natin yan ma-unlock. How can we unlock them? Through the use of what we call cell signaling mechanisms or cell communication. We can literally talk to our cells to unlock these genes para mabasa ng cells natin. Okay, so how do we unlock those cell signaling mechanisms like NRF2, NFKB, mTOR, PPAR, and PDNF? We can do that with using epigenetics or epigenetic signals. We can use our environment, our lifestyle, to talk to our genes, to unlock those codes. Ano yung most effective epigenetic signal para ma-unlock natin ang longevity? The most effective is caloric restriction. Ang problema, no one practices caloric restriction. Well, some, but not all. Pero ito ang isang napaka-effective way na ma-unlock yung mga bagay na yan. But the good news is that scientists have found out na merong katumbas. Merong mga tinatawag na mimic, manggagaya. No? We call them biomimickers, also known as biomimetics. No? And ano yung biomimickers that exist? Plants, halaman. Plants are the ultimate biomimickers. They can mimic the effect of caloric restriction. What about plants? They have a property known as phytonutrient. Phytonutrients are chemicals naturally produced by plants to protect themselves from harm and injury. So, yung phytonutrients na yan is represented yan ng kulay ng mga fruits and vegetables na iniinom at kinakain natin. Okay? But there's a particular group of phytonutrients that can mimic caloric restriction. And those are what we call polyphenols. No? Not all nutrients can do that. Only a specific group. Polyphenols lang yun. So under polyphenols, nandyan yung example dyan, flavonoids, no? Curcuminoids, green tea extract is also a polyphenol. So in our next module, we will go to that further. Hihimayin natin yan para mas aware kayo every time you go out there and prepare your food, buy your food and your supplement. Okay, so what happens is that by using polyphenols, no, aside from plant-based nutrients, you can do caloric restriction, intermittent fasting can also be done, high-intensity interval training. But in terms of nutrition, the key is polyphenol. So itong polyphenols na to, they act as mimics, ginagaya nila, and na-unlock nila yung mga cell signaling mechanisms. Those cell signaling mechanisms will now unlock your longevity genes. And these genes, when read, they express the following. Antioxidant systems are turned on, and there is now balance between free radical formation and oxidative stress. Another effect that they do is that inflammation is controlled. So naiiwasan natin yung chronic inflammation which leads to chronic degeneration or pagkasila ng katawan. Autophagy is turned on, and yung cells natin nakakapag-repair, nakakapaglinis, no? And mitophagy is turned on, which is nakakapag-renew yung cells by renewing the mitochondria. And another important is metabolism and energy production is properly regulated. So when all these genes are unlocked and these things etong mga function na to nagagawa ng cells natin, na-achieve natin yung tinatawag nating 5 R's. The 5 R's of healing our self. Remove, repair, rebuild, renew, regenerate. Nagagawa natin yan. And that is achieved by our own body, tayo with ourselves. But the catch is, in order to achieve these things, optimal nutrition is very important. Yun yung challenge natin today. Paano nga ba ma-achieve yung optimal nutrition kung ang pinaka-challenge in achieving the optimal nutrition is the everyday things that we do? Correct? So, the recap is not in your summary notes, but the rest of the discussion, you will have it in your guide. No? So, yung mga nakapag-print or those who have their mobile phones, you can now open your the file that we sent you, and you can follow with the discussion. For the meanwhile, I will shift to the slides. Saglit. Okay. Okay. Can you see the screen? Nakikita na ba o nakapause? Nakapause ba ako? Okay. Yan. Okay. So, the challenge is how are we able to meet, no? How we will be able to achieve optimal nutrition? Yun yung challenge. So, the main challenge today is basically our world is sick. The people who live it and the world itself, we are this is our health challenge, our main health challenge today. We're basically, teka lang ha, using ko lang yung slides. Okay. So according to Dr. Linus Pauling, no, siya yung nagsabi na all diseases can be traced to a nutritional deficiency. And this was backed up by Dr. Charlotte Gerson, who said that two factors play in our development of chronic disease. And this is number one, deficiency, toxicity and deficiency. So, no further explanation needed. Aware na tayong lahat dyan. Alam natin yan, no? Na ito talaga ang nagiging challenge ng tao ngayon. So, if you're going to look at this slide, this will show that chronic degenerative diseases are really in the top percent of the cause of mortality and morbidity in the world. And what people are not aware of is that chronic diseases are also classified as lifestyle diseases or nutritional diseases. Ibig sabihin, etong mga sakit na to, we develop this through our quality of the poor quality of our lifestyle and the poor quality of nutrition. So, hindi siya, kumbaga parang, lahat ng chronic disease na maisip mo, actually even infectious disease like COVID-19, the severity of your COVID symptoms is tied up to your nutritional level. Yung ability ng katawan mo mag-develop ng sakit na malala is rooted and deeply connected to the level of nutrition. Okay? So yun talaga yung kailangang pumukpok sa isip natin. Kasi maraming tao pag nagkakasakit, lagi nilang tinatanong, ba't ba ako nagkakasakit? And no one really pinpoints nutrition. Parang, kasi namana mo, kasi stress ka, kasi hindi ka nag-exercise, no? Pero walang pinpoint na it's micronutrient deficiency that is really the root cause in developing this risk for diseases. So why is this a problem? This is a US data. Pag makikita nyo, in the US, which mostly applies to the world today, especially in the Philippines, 65% ng adult poor diet. Okay? Pag sinabi natin poor diet, that's basically more on processed food and very low on fresh whole food, particularly fruits and vegetables. Sa bata, mas nakakagulat kasi 90%. Bakit 90% ang poor diet rate ng mga bata? It comes down to what we teach children. For example, tayo in our generation, nagkaroon tayo ng advantage na yung mga lola, auntie natin, like kami, we're Ilocano, ang mga lola, auntie, naku po, good luck sa'yo kung hindi ka matutong kumain ng gulay at prutas. Required. Pinupukpok talaga yun sa amin. Hindi ka pwedeng umalis ng lamesa nang hindi mo naubos yung gulay mo sa plato. And araw-araw may food serving kami. But the problem is that in yung generation natin ngayon, who are now parents and some of us are already grandparents, the problem is we indulge children. No? Laging nandoon yung ayaw ng bata kumain ng gulay at prutas so walang choice. Kaya puro processed food ang napapakain, correct? Kaya mas mataas yung rate sa bata rather than adults. And this is the dilemma today worldwide. About 95 to 97% of adults in the world do not meet the requirement for their fruits and vegetable intake. And this is now the cause of what we call mass nutritional deficiency. So nutritional deficiency is not just an issue here in the Philippines. And we're not talking about malnutrition na payat. Hindi na yun ang pinag-uusapan natin ngayon. What we are talking about is mass micronutrient deficiency. Yun ang challenge ngayon ng mga tao when it comes to achieving their health. So, bakit tayo nagkakaroon ng mass nutritional deficiency? Like we always said, we are living a sad lifestyle. It's the modern living, no? Modern environment, modern agricultural practices, modern food processing, modern packaging of food, no? So this is increasing the rate of artificial stuff, toxicity, artificial chemicals, and depletion of nutrient intake. So ito yung pinaka-challenge natin right now. And ang good news is that lifestyle is controlled by us. We control our lifestyle. So meron tayong pwedeng gawin. So hindi pwedeng excuse na deficient tayo kasi nasa atin ang control. Okay? So what about our lifestyle that's making our body unhealthy and very deficient of essential nutrients? No? Main concern is diet, the quality of the diet. Hindi lang quality, pati quantity. Okay? So, hindi na natin problema ngayon ang scarcity. Scarcity of food is no longer a problem. Maybe in certain sector of society, but the main issue today is over availability of food. 24 oras kung gusto mo kumain, meron kang ma-order. Tama? And this issue was worsened by the pandemic because of online 24 hours ordering food online, di ba? Available. Parang almost any food na maisip mo, well, bad food na maisip mo, pwede mong orderin and it's delivered through your doors. And the second issue is inactivity. People today are sedentary. 9 out of 10 people have a sedentary lifestyle, meaning you hardly move. And another issue is long sleeping hours. No? So itong dalawang bagay na to has changed our body over time. Okay? Binabago niya yung physicality natin, how we process nutrients, how our body absorbs toxicity, process toxicity, nagbabago siya. Okay? And it doesn't affect the physical body alone. It affects our mental health, our emotional health, physical health, and all the other parts of the 11 pillars of health. Lahat yan affected. And the main problem with the diet is that we are no longer eating food. We are eating food-like product. Anong ibig sabihin nun? Mas marami tayong nakokonsumo na artificially produced product or ultra-processed food compared to the fresh, whole food product. And as we remember kanina, dun sa board natin, optimal nutrition must come from whole food, plants. And the more plant-based you go, the more nutrients you put into your body, the less you go for fresh, whole food, plant-based diet, the less yung nutrition na makukuha ninyo. So whether you like it or not, plants is the go-to food of our cells for achieving health. Okay? So, bad habits, modern lifestyle, lack of sleep, long sitting hours, lahat yan nagko-contribute. Okay. What else makes our diet sad? Basically, SAD stands for the Standard American Diet. And this is the challenge for most people around the world. The world has adopted, unfortunately, a Western diet or what we call the Standard American Diet. The Standard American Diet looks like this. So kung makikita nyo, yung main foundation ng kanilang food pyramid is more on grain products, particularly refined starch, like refined flour, the refined GMO corn, no, refined grains. No? And the issue with this kind of product is that they are high in starch, very high in sugar, and the calories are coming from the sugar and very deficient of micronutrients. And tayo ngayon sa Pilipino, tayo ngayong mga Pilipino, ito na rin ang naging standard diet natin ngayon. And this needs to change. Okay? We need to go back to our ancient diet, or basically the diet of our grandparents and our great-grandparents. Okay? So, in the standard American diet, makita natin doon talaga is yung added sugar, no? Sugar on top of sugar. For example, eating fruits, that's all right because the sugar there is sakto lang and it's natural sugar. The problem is when you add, like for example, you're eating a bowl of cereal, yung cereal, refined grain na yon, so mataas na siya sugar yon, may added powdered sugar pa yon, tas dadagdagan mo pa ng fruits, then dadagdagan mo pa ng sweetener, so that's sugar on top, on top, on top, on top. And that's causing a lot of problems for us. And makikita dito talaga is that Western diet or the standard American diet is directly linked to the increase in weight gain and the rampant increase of what we call the metabolic syndrome. So ito ang challenge ng mga tao today. We are overfed and undernourished. Okay? And makikita to sa buong, this is an issue in the whole world, not just dito sa atin sa Pilipinas. Okay? So, talagang, this is a documentary. I think this is available in YouTube. You can search for this, overfed and undernourished. So, if you want to enlighten yourself more, educate your family and your friends, you may want to direct them to this very, very good documentary, Overfed and Undernourished. Okay. So because of this, this is the main issue in the world today, the rampant increase in overweight and obesity. Okay? Makikita nyo, buong mundo apektado. Okay? Walang parte ng mundo na walang problema sa obesity. It's our greatest challenge today. Health challenge, global health challenge. It's not even cancer, it's obesity. More than although ang focus ngayon is the COVID pandemic, pag titignan niyo po talaga, hindi po COVID pandemic ang main risk sa health natin. It is the rampant increase in overweight and obesity, both in children and in adults. Sa Southeast Asia, dito sa baba, makikita nyo, tayo, Philippines, pang-apat tayo sa most obese country in Southeast Asia. Number 1 is Malaysia, number 2 is Thailand, number 3 is Singapore, number 4 is the Philippines. No? And I think hindi na nga to updated kasi parang I think this is a 2015 sometime between 2012 2015 data pa to. Okay? So what happens when we are overfed and undernourished? What happens is we can develop what we call metabolic syndrome. So sa metabolic syndrome, ang nangyayari dyan, because our diet is too much calories, babalikan natin yung board. Di ba, what makes you healthy is caloric restriction. Okay? So dito opposite, yung calories mo so much, no, too high that it can no longer promote your longevity genes. It cannot unlock cell signaling mechanisms for longevity. So nangyayari, no, shut off yung metabolism mo, okay? Yung autophagy mo, which is responsible for detoxification, hindi properly nangyayari, inflammation goes up, no? Antioxidant levels goes down, and you develop what we call metabolic syndrome. So the hallmark of metabolic syndrome is fat deposition. Na? Nagkakaroon ng development ng stored fat in areas of the body that they're not supposed to. Particularly, deposit ng fat sa abdominal area or what we popularly call the belly fat. Okay. Again, bawal pikon, guilty din ako dyan, okay? At some point in time, and ngayon medyo guilty ako dyan and trying my best to resolve it, belly fat is not sexy. Belly fat is not healthy. Kahit payat ka or skinny ka, kung yung belly mo malaki, yung mid-waist circumference mo malaki, that is metabolic syndrome. And metabolic syndrome is the precondition for almost all chronic disease. It's pre-diabetes, it's pre-heart disease, it's pre-liver condition. No? So, ito yung initial stages. Okay? So, ito, dapat to ma-address. So, how do you know if you have metabolic syndromes? You have to look for these signs. 3 out of 5. If you have 3 out of 5 dito, then you have metabolic syndrome. So what do you need to look for? Blood pressure. If your blood pressure is consistently every day at any given time, greater than 130/85, fasting blood sugar over 100, okay? A waist circumference larger than 40 if you're a male, more than 35 if you're female, elevated triglycerides greater than 150, HDL cholesterol, which is the good cholesterol, is under the normal value, and your LDL is higher than the normal value. If you have any 3 of this, you have metabolic syndrome already. Usually, the first thing that will bother people is not the large waistline. Yung large waistline, pag yan lumalaki, usually defensive lang naman tayo. So naman tayong nararamdaman. What hits us is hypertension. Pag bigla mong nakita na ang taas-taas ng blood pressure mo, dun ka na natatakot, dun ka nagugulat. So, at anong gagawin mo? Diba? So, metabolic syndrome is 100% reversible. It should not go on. It must be corrected. And the most efficient way to correct that is proper diet and nutrition. So, metabolic syndrome is affecting Filipinos, no? And a lot of Filipinos are being affected. So I was able to get some data published by the National Nutrition Statistic, I think. Pero ito, ginagamit ni AXA sa presentation nila. Kaya may AXA dyan. Pero it's a good graph to show na talagang ang Pilipino ngayon from being at healthy body weight, talagang over the past maybe 20 to 30 years, no? Our weight's going up, and metabolic syndrome is going up. And makikita natin yan ngayon in correlation with the COVID pandemic. Karamihan ng nagde-develop ng severe COVID, and the main risk factor for developing severe COVID is obesity. It's one of the highest risk, obesity. Being overweight and being obese alone puts you at high risk for developing severe COVID. Okay? Why? Because it follows that when you have metabolic syndrome, you are overweight, you are obese, you are nutritionally deficient. And we know that with this process behind me, makita natin na nutrition is key in optimizing your immune system response as well. Okay? 1 out of 4 Filipinos are obese. 1 out of 4. 1 out of 4. Okay? 1 out of 4. So, and let's be careful because obesity now is also rampant in children as well. So I was able to get hold of this article. This was published in CNN Philippines. Okay, this is a data from the UNICEF 2016 report. Childhood obesity in the Philippines below 5 years old has increased by 400%. 400. Okay? And these children were not born obese. Karamihan dito sa mga batang to, normal body weight. And as they are getting older, they're getting bigger. So this is not good for children. And this will put them at high risk for developing chronic degenerative disease at an early age as well. Okay? So next part in the discussion is the role of drugs. So why am I emphasizing this? Dahil tumataas ang degenerative, ang chronic diseases, rampant din yung paggamit ng maintenance, well, technically therapeutic drugs for these diseases. So we're not saying that patients don't need this medication. Now, for certain conditions, they will need to take this. But the issue is the long-term use. So in this table, ang pinapakita dito is the chronic disease condition and the example of drugs that they take as maintenance therapy. Okay? But the issue is that over time, long-term use of this medication will lead to depletion of vitamins, minerals, antioxidants, and hormones as well in the body can get affected long-term. Okay? That is why it is really, really important that when you are placed on drug therapy, you have to make sure that you are continuously being monitored by your attending physician. Okay? Not because you are taking a drug per se, but because you also have to watch out for deficiencies. And these deficiencies play a role in the development of side effects. Okay? So, according to Dr. Kristen Northrop, who is an OB-GYN, and she is also she used to be a part of the medical advisory board of USANA. So, according to Dr. Kristen Northrop, side effects of a drug is not technically a side, no, hindi siya side effect. It is an inherent or innate property of the drug. And for every drug that you take, meron talaga siyang counterpart na nutrient na nabablock. Bakit bumababa yung mga nutrient intake na yon? Cell signaling mechanism, babalikan natin. Drugs like nutrients also use cell signaling mechanism. The difference is that your drugs, okay, it's either they block, okay, they either block or they compete for the receptor. Diba, remember niyo yung lesson last time? Yung cells natin, meron siyang mga receptor. So, yung receptor sites na yun, dun din pumapasok ang nutrients. The issue is that the chemicals in drugs, dun din siya papasok. So, between nutrient and drug, sino ngayon ang unang makakapasok? Supposedly, your cells go for nutrients first. But drugs were developed to either block the nutrient or they block the receptor. So nagkakaroon ng competition. That's why, ang consequence, for every drug you take, okay, it will lead to some form of nutrient deficiency. And ito yung hindi well aware ang mga tao. So it's very important that when you are on drug maintenance therapy, you should also discuss nutritional therapy with your attending physician. Because it's not the drug per se that will cause side effects and adverse effect. It's the nutritional deficiency that comes with it. Because as you take the drug, nutrients get depleted. So yung function ng katawan mo, yung function ng cells mo, nagkakaproblema din. Nerves get affected, muscles get affected, joints get affected, digestion will get affected. Kaya habang tumatagal na umiinom ka ng mga gamot na to, the more marami ka ding nararamdaman na hindi naman part ng sakit mo. Pansin niyo yun? Okay. So, this is a very, very important thing to be aware of. So, pag titignan natin, hindi sila technically magkalaban. Hindi ka pwedeng mamili. Hindi pwedeng pag uminom ka ng gamot, hindi ka na magtitake ng additional nutrition. Hindi pwedeng pag nag-take ka ng nutrients, hindi ka na magtitake ng gamot kung may sakit ka, di ba? So they have to come together. Okay? They have to come together. This is also the explanation why you need to have an interval period between the drugs that you take and your meal or maybe the supplement that you take. Kasi meron mga gamot na pag pinagsabay mo sa nutrient, nababaliwala yung nutrient kasi binablock niya lang din. Or may mga gamot na hindi properly ma-absorb kasi magko-compete siya dun sa nutrient. Okay? That's why an interval period is very, very important. And following the instruction of your doctor for your drug intake is very, very important. If the medication is before a meal, it has to be before a meal. If it's after a meal, then follow the instruction kasi that will play a role in cell signaling mechanism and that may affect yung efficacy ng supplement mo, ng diet mo, and the drug that you take. Okay? So if you are not aware of this, this is something that you can use for your family members, even for yourself, clients ninyo na nagtitake ng mga maintenance, ipakita nyo lang to sa kanila. So there are more tables available online. This is just a short summary. Ang dami niyan. Okay? So para lang alam nyo na may awareness lang na the fact that you are taking maintenance medication is also a reason in itself to have additional nutrition. Okay? So dun papasok yun dun. Okay, so, di ba, marami tayong taong kinakausap, sabihin nila, balanse naman yung diet ko eh, nag-exercise naman ako eh. Kaso may maintenance ako. Paano yun? Di ba? And then, ayaw niyang mag-take ng additional nutrition, no? So, kahit na kiniklaim niya na balanced diet siya, nag-exercise siya, fit siya, the fact that he is taking a maintenance medication in itself is reason enough for added support. Okay? So, napaka-importante ng bagay na yun. So, I hope that enlightens everyone and that can help you when you are discussing and approaching people, no? With regards with the need for supplementation. Okay? So, sabi nga, di ba, it was predicted, Thomas Edison predicted it, the doctor of the future will no longer treat the human frame with drugs, but rather will cure and prevent disease with nutrition. So nakikita na natin yan ngayon. No? A new branch of medicine has been in popularity for the past almost 2 decades. We call that functional medicine. Functional and nutritional medicine. So this is a branch of medical practice wherein ang focus is using diet and nutrition to support the function of the cell. Because if you support the function of the cell, na ibabalik mo yung normal function niya, and then any disease process can be helped reverse, no? And yun yung na-explain natin kanina dun sa recap natin. So, why does taking one vitamin or multiple vitamin or mineral help your body to get better? Now, why do you feel better when you're taking additional nutrition? So, kung makikita niyo itong map, itong parang sketch na to, itong diagram na to. Okay. This is the diagram of all the cellular ito yung iba-ibang metabolic and cell signaling mechanisms ng cells natin. This is the entire map. Okay? Sa bawat linya dyan, may mga nutrients dyan. Okay? So, ito yung naiintindihan ng mga nutritional scientists na hindi alam ng karamihan ng medical practitioner. Nakakalimutan na. So, this is how critical micronutrients are. There is no pathway here that does not require micronutrients. Lahat yan. Yung Krebs cycle last time, maliit na part lang yun. It's just a small part of a greater picture. This is how intricate your cells work, and they work in close connection with your nutrients. Okay? I got this illustration from Gall Laboratories. There's a Gall Laboratory website, and you know, Gall Laboratory was originally founded by Dr. Myron Vance. Okay, and this is what they know. No, they know cellular function. They know cellular pathway. And through the Gall Laboratories, kakaaral ng cells. Okay, doon talaga naintindihan ni Dr. Vance yung critical role ng nutrition. By studying cellular function, now he knows what are these things that are supported by nutrients. Kaya huwag tayong magtaka na once you improve your diet and nutrition, nag-i-improve yung pakiramdam mo. Okay? It's not the vitamin, the mineral, or the antioxidant that's helping you make you better. These micronutrients are helping the pathways, and it's the cells that's making you better. Okay? That's why mahirap i-claim na ang vitamins ay nagpapagaling because they do not directly cure you. But what they do is that they help support the mechanisms that can. Okay? And without them, these mechanisms remain unsupported, and instead of being healthy, you feel unwell. Okay? So, human nutrition is basically defined as it is the science of how we turn food into the building blocks that is needed by the cells. Okay? So here, define nila ang human nutrition as the science of food and how it relates to health. It involves the process of turning food into the chemicals or the micronutrients needed by your body in order to function, to protect itself, and to renew itself. Okay? So, we are literally what we eat. So, lagi natin ini-emphasize, we have to practice mindfulness. Now, be mindful. Okay? Be mindful of what? Every time something, before you buy something, before you eat something, pag-isipan mo maigi. Okay? Healthy, unhealthy. Di ba napakadali ng choice? Madali. Okay. Para sa karamihan, mahirap daw. Pero kung tutuusin mo, basic lang siya. Madali lang siya. So always remember, you are what you eat becomes you. Hindi lang food, pati TV show na pinapanood mo, libro na binabasa mo. It influences your cells. Okay? So always remember, marami tayong cells sa katawan, and lahat ng cells na yan, babalik tayo doon, lahat ng cells mo, may ganyan. May ganito. Okay? Yang mapa na yan, kada cell yan. That's for every cell. Not for the entire body. That's for every cell. Okay? Now, all of those pathways needing support in order for those 100 trillion cells to function. So, according to Dr. Myron Vance, the cell, simple lang siya. Poison it, injure it, or starve it. The resulting damage is degeneration and disease. No other way to go. But the cell, nurture it, protect it, and feed it with the right nutrients it needs. It will repair itself, providing us with health and longevity. So, if you're somebody trying to make a point sa kausap mo, why do you need supplementation? Ako, this is the slide or what I explained to them. Napaka-basic, napakadaling intindihin. Kahit bata, maintindihan niya. Bakit ko ba kailangan ng additional nutrition? This. this is the simple thing that will explain it. Okay? Put something negative, the result is negative. Put something positive, the result is positive. You need to support 100 trillion cells with thousands of mechanisms. A single absence or a depletion of a single nutrient will cause a disruption in this well-balanced mechanism, and that will lead to disease. Okay? So what are the nutrients that we need? So aside from the macro, so we have what we call essential and non-essential. So essential nutrients are basically the nutrients that is required by your cells to live, function. Okay? They cannot operate without these essential nutrients. So you have the essential macro and the essential micro. Okay? But there are also non-essential nutrients. And the most important among the non-essential nutrients are your plant antioxidants, also known as dietary phytonutrients. So dapat yan, no, na lahat yan dapat nakukuha natin from the diet, and because the diet is lacking, we can get that from additional supplementation, and that will now help nourish, protect, and help renew the different cells of your body. Okay? So, yung dating sabi-sabi, lagi natin itong naririnig, di ba? Every time you go to your doctor and ask for advice, what's a healthy diet? They always tell you a balanced diet. But what's a balanced diet? Di ba? So, dati, yung balanced diet natin, if this is you're seeing now the healthy eating pyramid. This is the new one. Ito na yung ni-revise ng Harvard School of Public Health. So, ito na yung dapat sinusunod. Okay. Yung dating balanced diet, baliktad. Baliktarin mo to, itong pyramid. Ito dati yung pinakamarami, carbs and starch. Ngayon, flip over na yan. Flip over. So, when you're thinking of a balanced diet, put this eating pyramid in mind. This eating pyramid in mind. So, maganda tong guide. Okay? So, basically, pag titignan mo dito sa baba, yung pundasyon niyan, healthy lifestyle. And the things that you need to incorporate in healthy lifestyle is, of course, practicing caloric restriction. So, how do you do that? No? Removing the starch or lessening the starchy food or the starchy carbohydrate. Practicing intermittent fasting, no? Exercise. These are things that can already help you with caloric restriction. And then, the second level of your pyramid must be micronutrient-rich food. Okay? The vegetables, the fruit, no? Healthy oils are now accepted as one of the basic foundation. And whole grains, not for the starch, but because of the fiber. Okay? Yung fiber and yung micronutrient intake, then you build on top of that. Okay? And always mind the color of the plants you eat. Plant-based food nyo must be colorful. Remember, as we said, yung phytonutrient that helps you unlock your cell signaling mechanisms are in fruits and vegetables. Particularly pay attention to the color. Okay? So you want variation. You want the red, the purple, the green, the white, the orange, the yellow there. Because the more variation you get, the more different types of phytonutrients you get. And you're increasing the amount of antioxidant that will help you with your cell signaling mechanism. Okay? So, deficiencies, no? So, sabi nga, di ba, lahat ng tao pag tinanong mo, are you healthy? Yeah. Why do you say you're healthy? All people will say, I eat a balanced diet. But, if you're eating a balanced diet, bakit ganito ang deficiencies natin? Okay? So, adult men are this much deficient, and an average adult woman is this much deficient. Okay? And no wonder, a lot of people talaga are having a hard time feeling better, feeling healthy, and achieving their health goals. Okay? Now, aside from the kind of nutrients that you need to eat, the level matters. The amount that you take matters. So, whether you like it or not, there is a level that will put you at optimal health. Optimal health requires optimal nutrition. Unfortunately, what the government wants us to follow is basically RDA. Okay? The government loves to take care of our health so much. They created a standard, and the standard level is the RDA. RDA is known as the recommended daily allowance. So it now comes in different names. It's also known as the RENI or the RENI sa Philippines. We call it the RENI, required energy nutrient intake. It's also known as the DVI, daily value intake, or DVA, daily value amount. But basically, the RDA is the minimal amount of essential nutrients, particularly vitamins and minerals, that you need to be able to take on a day-to-day basis to prevent nutritional deficiency like scurvy, beriberi, and rickets. So the history of the RDA level is World War II. So I know most of you are familiar with that. But basically, during World War II, the soldiers that were sent fighting the war, they started developing diseases like rickets, no, beriberi, and experts found out that this is because of deficiency in vitamins and minerals. So what they did was they created vitamin pills like vitamin C pills, no, magnesium pills, calcium pills, that contained a minimum amount of these vitamins and minerals, and they started giving this to these affected soldiers, and they started to improve and get better from these diseases. So that's where the RDA level started. And up to now, the standard for nutrient level is still RDA. Okay. But the problem is the RDA level is not the amount enough to support nutrition, protection, renewal, and cell signaling mechanisms of your cells. Okay? Hindi kaya. Okay? Dahil hindi kaya, okay, hindi natin na-achieve yung optimal health natin. So akala natin, if we follow the balanced diet, if we take food with fortification, and if we take regular over-the-counter supplement, we think that's enough already. But that's not enough. That's just small amount. Okay? There is such a thing as what we call optimal daily allowance, or the ODA. The optimal daily amount or optimal daily allowance, this is basically 100 times higher than the RDA level. And this is the nutrient level needed to support the map. Nakita niyo yung map kanina? The map of the 100 trillion cells. Yung metabolic pathways of the 100 trillion cells, ang kailangan niya, optimal. Bakit kailangan ganyan? Okay? Because your cells have many functions. And the challenge is that micronutrients are not stored long-term inside your body. Okay? The challenge is, one, your vitamins, minerals, antioxidants, they don't stay long in your body. Second, your body cannot produce them. We have no capacity to make them. That's why we need to take them every day, and we need to take them at the right amount. Okay? So, mas poor yung lifestyle mo, mas deficient ka. Okay? Mas pangit ang quality ng lifestyle mo, mas deficient ka. Okay? So, how do you improve the deficiency? Okay? You have to correct the lifestyle. And one of the main factor in the lifestyle that you need to correct is the amount of nutrient intake. Ang challenge nga is quality of food. Dahil hindi na ganun ka-rich in nutrients yung mga pagkain, we need to add on. And the gap between the RDA and the optimal level, this gap, makikita nyo dito sa graph, yung gap na yan, dyan papasok ang supplementation. It bridges the gap. Bridge the gap. Okay? RDA is basically, if you're eating fruits and vegetables daily, maybe you are RDA. But if you are relying on fast food, processed food, nasa estimated average requirement ka lang, mas mababa pa yan sa RDA. Okay? Kaya huwag ka magtaka bakit araw-araw you're feeling weak, no, you're getting headaches, You've got foggy focus, hirap kang mag-concentrate, malabya ka, konting galaw mo lang hingal ka, no? Hindi nawawala yung mga discomfort mo sa katawan mo kasi you're not reaching optimal level. That's the goal. Okay? So, if you're going to look at this table, you can search this, Google search this one. Keywords would be RDA versus ODA. You go to Google Images, you can see this table. So this is an example. So this is the micronutrients that we need to take every day because we cannot produce this and we use it daily, so nadideplete to. Ito yung level from an average diet. This is amount that you get. Okay? If you are on a good diet, like you're eating fruits and vegetables every day, you're following the 4 to 5 servings of fruits and vegetables, then maybe this is what you get. Okay? So this is the RDA requirement. Kung nag-fortify ka, nagtitake ka ng mga over-the-counter food supplement, maybe you get RDA. But if you're using pharmaceutical grade supplements, you may be able to reach what we call the optimum daily allowance. Okay. So makita mo yung gap, ang layo. So the gap between good diet and optimal intake is 85%. Ang difference. There's an 85% gap between just diet alone and reaching optimal level. Malayo yan. Okay? So another example would be this. Okay? So, dito in-indicate niya yung shortfall. Okay? So, if you are on RDA level, and if you are on optimal level, okay, how much is the shortfall? Ito yung difference. Okay? Dito papasok yung quality ng supplement mo. The difference between a food grade supplement and a pharmaceutical grade supplement makes a big difference. It's about the levels they provide. Food grade supplement, which are basically the common over-the-counter that you can buy, are basically at RDA levels. Pharmaceutical grade supplements can help you reach your optimum daily allowance. Okay? Unfortunately, only 3% of supplement brands in the market today can give you ODA. 3%. 3% lang. So let's say 100 brands, malamang 3 brands lang yon. So sa 1,500 supplements na nakapublish na Nutri-Search Guide, 3% lang doon ang pharmaceutical grade. Okay? And this is what most people don't know, na there is a difference in quality. Not all supplements are created equal. There's a big difference. Okay? Common food grade supplements are usually RDA. They're basically just 20% higher than your dietary intake. Your optimal daily allowance are usually achieved by pharmaceutical grade supplement that puts you close to about 95% to 100% more than the RDA. Okay? So, so alam ko excited na kayo, pero si Yusana is one of the 3%. One of the 3% nutritional brands that are classified as pharmaceutical grade supplement. The levels of nutrients in your Usana supplement, particularly the Silsentials, is at ODA level. It's the reason why adding Usana supplement, especially the Silsentials, in your daily nutritional lifestyle makes a big difference compared to when you were not taking it. Okay? So, again, if you want to download more tables, search words would be ODA versus RDA. Go to Google Images and you can get examples of these tables. Okay? So again, ODA, RDA, they matter. This is what we call the health illness continuum. Okay. So this is the illness wellness spectrum. Too little nutrition, you go to the negative side, the development of chronic disease. Optimal level puts you on the positive side. Okay? The highest level of wellness. And remember, if the supplement that you take, aside from essential micro, contains those polyphenolic compounds as antioxidant, okay, you're not just reaching ODA level, you are unlocking longevity genes. You are unlocking cell signaling mechanism that codes for longevity. Okay? No wonder, aside from feeling stronger, more stamina, feeling better, no? When you're taking USANA supplements, particularly the USANA Essentials, you see the results of longevity. Not just physically, if you do your test, nakakatulong siya with you. We're not claiming anything, ah. I'm not claiming that the product itself is doing that. What we're explaining here is the level of the nutrition, the amount of nutrition, the combination of the nutrients is helping the systems, the cellular systems. And it's the cell that's doing it. Okay? It's just so happen na yung combination na kailangan mo and the amount that you take is provided for by the product. So, emphasize lang natin. Okay? So again, vitamins and nutrients, micronutrients, they cannot be produced by the body, so you need to take it every day. Otherwise, neglecting this can result in deficiencies that will hurt you as days and years pass by. Okay? So, napaka-importante niyan. So, kung hindi ka pa convinced why you need to take more nutrition, I hope, eto lagi ko itong sinishare. In the causation of cancer, micronutrient deficiency is one of the main cause. No? Micronutrients does not just unlock genes in your DNA, they make up your DNA. Yung structure ng DNA natin, ng genes natin, is made up of nutrients. So when you are nutrient deficient, the very thing that makes you work is the very thing you compromise. And that is your genes. Okay? Regeneration happens with nutrition. Degeneration happens when you lack nutrition. Okay? So, the very thing you compromise when you are not at optimal levels of nutrient intake is your genetic code, your DNA. Yan ang number one na naaapektuhan. Okay? And nako-compromise yung ating ability to express health. Instead, it's leading to disease. So, in summary, why do we need to take supplements? Well, absence of complete and balanced full food in our diet. Okay? Lifestyle factors like stress, inactivity is also adding to deficiency. And all these nutrients must be taken daily in order to support the body. And we can only take this through the diet or through supplementation and add on supplementation. So always remember the goal is for you to take this from the diet. Okay? Mas pinaka-importante, diet pa din. An apple, a fresh apple contains different forms of nutrients combined in a synergistic manner compared to taking single vitamin and mineral alone. Okay? So, dapat ang focus natin when it comes to amping our nutrition, whole food diet pa rin yung gusto natin. But because nga of modern agricultural practices, more modern food process, yung food natin is not as quality as before. And this is where supplement will come in. On top siya, supportive siya, not a replacement. You cannot replace whole food with supplement. They need to work together. Partners sila. Okay? Hindi pwedeng, okay, sige, inumin ko na yung supplement ko, pero okay lang ba fast food na ako forever? Hindi pwedeng ganun. Okay? Hindi mo pwedeng i-compensate yung pag-inom mo ng supplement sa fast food diet mo. Okay? So it's the best way to do it would still be a whole clean, uh, a great proportion plant based, and then you add on the supplement that you think is lacking in your dietary lifestyle, and that's your nutrient source. Okay, and how do you maintain the level? By exercising regularly, by minimizing your stress, by healthy sleep. Okay, this is how you maintain the levels of these nutrients, the way to for your body to use it properly to maintain your body. Okay, so dietary supplement is a big market. It's a trillion dollar. It's going to be $1 trillion business. May share lang ako sa inyo na nahagilap ko na article. Okay. So this is from PRN Newswire. So makikita natin dito, this was January 16, 2019. It says here, the Philippine nutraceutical market is expected to reach 261 billion pesos in terms of revenue by 2022. What does this article show us? A lot of people are educated about supplementation. A lot of people are already aware that supplementation is a requirement for keeping with their health daily. Okay? And a lot of people are willing to invest in their health, in their body. And one of the ways they know to do this is by taking a supplement. Okay? So this is a good article. So you can search for this. Okay? Teka, I'll copy the link. Send ko sa chat. Yeah, sent. Okay. Okay. So very popular supplementation worldwide. So different people have different reasons for supplementation. So USANA did a survey, and this is what the survey came up with. No, 44% of people take supplement for overall wellness. That's the number one reason why people take supplement. They take 30% use it for energy. This is among the male supplement users. And 28% is to boost immune health and boost heart health. So if you're speaking to male adult clients or contacts, this is what you may probably need to emphasize, no? Overall wellness, energy, immune health, heart health. These are the things that they want to hear. Among female supplement users, the main reason is again overall wellness. The second is filling the gap, no? And bone health. A big concern among female adults is bone health. The survey also found out that 67% of people who take supplements are exercise regularly. So this shows us that people who are into physical fitness are also really into supplement intake. Okay, and another part of the survey is that 87% of people who take supplement claim that they are eating a balanced diet. Okay, but they know the balanced diet is not enough. That's why they add supplement. So yung awareness ng mga users ng supplement, mataas na rin talaga. 76% of supplement users do visit their doctors regularly. Okay. So what does it mean? One, okay, probably their doctor are educating them about the benefit of supplements, which is good. Okay. Or second, their doctor may not support them with supplementation, but that person knows he or she needs it. They're educating themselves. That's why they're into supplementation. Okay? Yung level of awareness nandoon. Okay? So napaka-importante niyan. So what are the issues with supplementation? This is from My Sports Science. This is a survey that we did. 40 to 70% of athletes do take supplement. Okay? Athletes really know, and sports nutrition is really into supplementation. But 10 to 50%, 10 to 15% of supplement brands contain prohibited substances. And this is the one of the reasons why very, very careful ang mga athletes sa pagpili ng supplement brand na iniinom nila. Kasi bawal ang mga contaminants and prohibited substances sa supplement. Otherwise, they lose their opportunity to compete. Na? 80% 80% of supplements, according to athletes, are not really declaring what they contain in the label. Label claim issue. Okay? So yung label claims na yan, napaka-importante niyan because tayong mga consumer, whether we're athletes or non-athletes, the only thing na pinanghahawakan natin when we buy a supplement is what is on the label. Okay? Unfortunately, claims on the label are not strictly regulated. And kaya tayo as consumer, dapat mahigpit tayo sa pag-review ng label claim. We really need to learn how to read labels, and we must be able to verify and validate the claims on these labels. When you're buying supplements, food supplements, nutrition, dietary herbal supplements, it's really basically buyer beware. Okay. Yung nasa label, kailangan mo yan i-validate. Okay? Basically, what's on the label is basically tied up to how honest the company is. Okay? Kasi by FDA ruling, FDA does not really need to, kumbaga parang, meron lang silang rules kung ano yung dapat i-declare, pero hindi binavalidate ng FDA kung yung nasa label ba ay nandoon sa product. Hindi role ni FDA yun. Okay? So, kaya kailangan, pag bumibili ka ng supplement, busisiin mo yung label. Ang tanong, paano mo siya bubusisiin? What can guide you? And that would be the NutriSearch guide. That is really a good guide in discerning label claims. Okay? So, we'll go to that further on. And largely, most athletes and general population in general, kaya sila hesitant mag-take ng supplement is they think it's not backed by evidence. Okay? That's why you really have to look at the background of the manufacturer, the company. No? And it has to be science-based. Nutritional supplementation must be science-based. And it is, dapat yung mga company na yun, they are able to provide information regarding the research behind the development of the formulation of their product. So, ngayon, ang maganda, most companies, especially like USANA Health Sciences, they are very, very open. Open sila sa sharing ng information. Pinapublish nila talaga on their own websites. They even publish it on journals. Yung mga research and development that goes on behind their products. Okay, so napaka-importante niyan. Okay, so next, then yun nga yung question, no? Label claims, so how do we know? So there's a way to do that by using the guide, the NutriSearch guide. That's one of the things that can help you. Websites that can help you look at and validate labels are also consumerlab.com. No? You can verify supplement ingredients there. You can also go to NSF. No? They're also an independent company that also does validation auditing ng mga label claims ng mga iba-ibang supplement product. Okay? So just like to show you this, i-relate lang natin tong topic natin sa COVID-19. So the COVID pandemic has changed supplement popularity in 2020 according to consumerlab.com. So you can pull this article out of the consumerlab.com website. So lagay sila ng article doon na during 2020 tumaas ang pagbili ng tao ng supplement. Okay? Kasi na-connect talaga na ang immune system is very, very important, and that the immune system is really tied up to nutrition. So according to the survey of Consumer Lab, ito yung popular nutrients na hinahanap ng tao ngayon sa supplement brands. Okay? Number 1 na hinahanap is vitamin D. So we all know that vitamin D is one of the critical nutrients for immune system support. And this is actually advised as supportive nutrition for patients with COVID. I-encourage talaga na mag-take ng additional vitamin D. So another nutrient that's very popular, that became popular during the COVID pandemic is omega-3 fatty acids, particularly fish oil, magnesium, multivitamin, including prenatal multivitamin. Ito talaga yung mga people are buying and loading up on this. Coenzyme Q10, vitamin C, probiotics, zinc, curcumin, B complex. These are the top 10. Ang commonality nitong mga nutrients na to are, these are the nutrients that are really known to support immune system health. Okay? And are also powerful antioxidants that help with inflammation. Okay? Ang maganda nito, we all aware kung what's the best quality brand na pwede nilang i-take. And through this training, now you know na people who are looking for this must be aware na may difference. Baka yung nabibili nila food grade, hindi pharmaceutical grade. So we want them to maximize the effect by making sure they're getting the optimal level. So by helping educate them, raising their awareness, we can guide them now. So ito yung mga ping. If you're going into, when you're in Facebook, you're looking at, or Instagram, you're checking your potential clients or your suki, no, yung mga regular buyers ninyo, what they are looking for, no. This is something that you can share. So you can go to the nutrisearch.ca. That's the website of NutriSearch. You can pull up the article there, or you can go directly to consumerlab.com. So ito yung mga featured articles nila ngayon. Okay? Maganda yan. Kompleto tayo niyan. Meron tayo niyan. And makikita nyo yan, sa Essentials pa lang, nandun na lahat yan. Okay? So that's a good thing to emphasize. Diba? Okay. So let's go to supplementation. The history of supplementation. So, ito, summary na lang, kwento na lang yung gagawin ko. But I found a link that you can go to para ma-educate kayo further about supplement history in the Philippines and basically in the US. Kasi medyo yung regulations ng Pilipinas, nakapattern tayo sa ginawa ng Amerika. So, I found these links. So this is the US FDA website. They have their a Q&A and an FAQ section. So I'll just share the link with you and I'll put it in the chat. Okay? So dito sa FDA website na to, maganda yung summary nila. So they just give you a basic definition of nutrition. But basically in the US, ang nangyari sa supplementation, ang history ng supplementation is during the 1800s to early 1900s, scientists started to identify the different vitamins and the different minerals. Like Dr. Linus Pauling is one of those who helped identify particularly vitamin C. And with their identification of the different micronutrients, nakita nila that this is also linked to what we call nutritional deficiency diseases. And if you add these vitamins in the diet or in the daily lifestyle, pwedeng ma-prevent itong mga nutritional deficiencies na to. Dito nag-start yung mga single vitamin pill. like a vitamin C tablet, a calcium tablet, no? Doon yun nag-start. And then, the awareness of people regarding the benefit of supplementation increased. So left and right, people started making their own product of vitamin pills and vitamin supplement. And then in the 70s, nag-start yung multivitamins, no? The multivitamin product. And again, walang regulation. Anybody can make their own product and then market it, ibenta, and then people can buy, they can start taking. So walang nag-check ng safety. No? Quality and safety, walang nag-check. So the FDA, the US FDA, was established around 1930s in the US. So with the establishment of the FDA, nagkaroon ngayon ng government agency ang US na nagre-regulate ng food, drug, and also cosmetic. Okay? But the problem was, hindi sila mahigpit. Basically, tinitignan lang nila doon, mag-submit ka lang ng proposal mo ng supplement product mo, basta naki-indicate lahat ng kiniklaim mo na ingredient with the amount, and as long as walang potential harmful substance doon, ina-approve na yun ni FDA dati. Then pwede nang ibenta, pwede nang gamitin. But something changed during the administration of Bill Clinton. So in 1994, Bill Clinton established the DSHEA, DSHEA. DSHEA stands for the Dietary Supplemental Health and Education Act of 1994. So itong DSHEA na to, this is a law, a bill, legislation to. So the DSHEA is a law approved by Bill Clinton in 1994, and this law is now used by the FDA to particularly regulate supplements. So ito na yung law na nag-re-regulate ng supplementation. And with this law, ang supplement is classified under food. Napasok siya sa food product. And ang pinaka-importante doon is naka-declare yung mga ingredient, the amount must be declared in the label as well, and dapat nandoon yung no approved therapeutic claim. Ibig sabihin, food supplement cannot claim any cure or anything related to curing diseases or illnesses. But they can have claims like may help improve, may help support, pwedeng ganun. Pero hindi pwedeng magkaroon ng direct claims kasi ang FDA, hindi niya binubusisi ang food product kung may health benefit ba yan o wala. Ang kailangan niyang tignan is it safe? Is it safe for human consumption? Iba ang usapan kung drug. Pag drug, yan yung binubusisi ng FDA. Ano ba ang action niyan? Ano ba ang effect niyan sa katawan? Ano ba ang nagagawa niyan sa sakit? Yun yung mga inaaral ng FDA. But if your product falls under supplementation, FDA basically regulates it as it regulates any food. So kailangan lang naka-declare yung content sa label, naka-declare yung ingredient, then yung amount, and ang basically titignan dyan ni FDA is, ang importante, wala siyang harmful, directly toxic, or poisonous, or contaminating substance. Pag clear na yon, approved na yon, pwede na yon i-market, pwede na yon ibenta. So hindi rin niya bini-verify kung RDA or ODA yung level ng nutrient mo. Hindi yun responsibility ng FDA. So basically, ang titignan lang ng FDA is safety. Is this safe for human consumption? Okay? The product must contain dietary ingredients, meaning ingredients that are also seen in food, like vitamins, minerals, herbs, amino acids, enzymes, acceptable yun. Okay? And then, so yun yung basically tinitignan niya. So, hindi tinitignan ng FDA kung ano ba ang may therapeutic effect ba to, yung gano'n. Kaya, automatic, pag ang product mo is food supplement or dietary supplement, automatic kailangan nandoon na yung label. Dapat nasa label yung no approved therapeutic claim. Because the product you are submitting is a food or a dietary supplement. But if you are submitting for a pharmaceutical grade supplement, okay, dun bubusisiin yung content ng product mo. And doon mo kailangan mag-submit ng supporting clinical studies, clinical trials, clinical evidences. So, doon lalabas ngayon yung kailangan mo siyang patunayan. Okay? Kaya pag makikita nyo dun sa mga product natin, meron tayong may USANA product na merong no approved therapeutic claim kasi ang submission niya sa FDA is dietary supplement. So dahil dietary supplement, yung hinihingi niyang certification, automatic, nandun na yung no approved therapeutic claim. And ang kailangan lang gawin ng manufacturer is ilagay sa label lahat ng ingredient, amount, and dapat nakalagay doon yung no approved therapeutic claim. Okay. Now, for other products na kiniklaim nating pharmaceutical, meaning the level is pharmaceutical amount and that they have potential action for prevention and therapeutic, kailangan mag-submit ng additional research doon. Kailangan ma-establish yung link, yung proof na yung kiniklaim mong benefit na prevention and therapeutic ay nasusuportahan ng data. Okay? And that's what happened with your Silsentials and your Usanimals and your Proflavanol C100, no? Talagang sinubmit yon with therapeutic claim. Hindi lang siya basta dietary supplement, pharmaceutical grade supplement. So, I hope medyo na-clarify yun sa inyo. Okay. Regarding Philippine regulation, this is the best that I could find. So this is a link, basically Asia Pacific Food Law Guide, which also is followed by dyan din naka-pattern sa Philippines. And then again, I'll send it here, the link. Okay. So, kasi medyo madali siyang intindihin. If you just really want to go into it, okay, para mas matutunan niyo paano yung process ng paano nagiging dietary supplement ng isang product and what is the difference, no? How they are regulated. Okay. So, for the Philippine FDA, what are food or dietary supplement? So, according to the Philippine FDA, ang definition is any product that contains dietary ingredient like vitamin, minerals, herbs, amino acids, or any substance from plant or animal, whether natural or artificial, can apply as food or dietary supplement. Interchangeable terms. Okay, they can come in form of liquids, capsules, pills, tablets, powders, or gels. Okay, and they are not marketed as conventional food, and they cannot be marketed as replacement for drugs or medicine. Okay, so yun yung definition ng Philippine FDA sa supplement. Okay, and then according to the Philippine FDA, labeling. Ang importante doon is naka-declare yung ingredient, naka-declare yung amount niya. Okay? Yung weight, amount by weight, hindi amount by nutrient, ha? Amount by weight. Kumbaga, in a tablet, kunwari may vitamin C, may calcium, may magnesium, dun sa tablet na yon, anong amount dun by weight ang vitamin C, ganon. And then yung listahan, yung list sa label, yung pinakamalaking amount na nutrient, yun yung nasa una sa list. And then going down to the smallest. Yun yung regulation sa label. Okay? And then, kailangan din, nakalagay dun sa label, yung concentration ng nutrient according to the RENI or the Philippine Daily Requirement for Nutrient. So, dapat nakamatch siya sa RENI, yung RDA ng Pilipino. Okay? And ang isang tinitignan din ng FDA is dapat walang microbiological contaminant, meaning walang potential microorganism that can cause illness. Okay? And dapat walang illegal drug or contaminant din dun sa loob, especially marijuana, opium, yung mga ganon. Bawal i-include sa food or dietary or herbal supplements. Bawal siya. And kailangan nakadeclare yung mga excipients or any additives must be declared like artificial sweeteners, food colorant, preservatives, enhancers. Dapat nakadeclare din yun sa label. So yun yung chine-check ng Philippine FDA when you are submitting your application for a food or dietary supplement. Okay? So, you can read this further. Meron ito sa Philippine FDA website natin. Doon ko din naman to nakuha. But siguro, dun sa supplementary guide nyo, i-email ko na lang kay Coach Nixie para ma-email sa inyo as additional information. Okay? So, the challenge now is how to choose. So, ika-clarify ko lang. Si Philippine FDA, pagdating sa supplement, pag nag-apply ka, magsasubmit ka ng application mo for supplement. Okay. So, automatic yon. Ang tingin ng FDA sa product mo is food product. Okay? A dietary supplement automatically is looked as a food product. And kung ano yung regulation regarding sa labeling ng mga food product, yun din yung ina-apply sa dietary supplement dito sa Pilipinas. Okay? So, sa FDA is, ano yung ingredient? Dapat yung ingredient ay dietary. Okay? Ano yung amount noon per weight? Nakalagay dapat sa label mo yon. And nakabase dapat yung nutrient level sa Philippine RDA or the RENI. Dapat nakamatch siya. And any additional ingredient dapat nakadeclare. Excipients, additive, flavorings, enhancers, dapat nakalagay yun doon. And yung supplement na sinasubmit mo ay food grade, automatic nakalagay doon yung no approved therapeutic claim. Okay? Kasi as a food supplement or a dietary supplement, you cannot claim directly treatment or prevention. Okay? So, yun na yung kailangan mo i-submit. And pag na-approve na yon, okay na yon, pwede mo nang i-market yung product mo. Pero hindi role ng FDA na i-double check na yung sinubmit mo ay yun talaga yung laban ng product mo. Okay? Hindi na niya yun titignan. Wala na siyang pakialam doon. Kaya nagkakaroon ng mistrust sa supplement. Ang nangyayari ngayon, most people know or think na kapag supplement, hindi siya quality. Na-associate na low quality. Kasi alam na hindi naman binubusisi yung content. Okay. So now, how do you know the difference? Kasi merong difference when it comes to supplementation. Okay? Nagkaroon ng evolution ang supplement regulation. So around 2000, 2006, in-impose ni FDA yung tinatawag na GMP process. Okay? And then, in-update ngayon, yung updated is now what we call the current GMP or the current general manufacturing process. So, under the adaptation of the GMP, nung simulang gamitin ang GMP, nagkaroon ngayon ng 3 level ang supplementation. So, the first level is feed grade. feed grade GMP. Sorry. I'll go back sa board. And supplements. Okay? So, sama-sama lahat yan. Drugs pala, hindi pa supplements. Sorry, wala pa pala yung mga supplements. Food, cosmetic, and medicinal drugs. Okay? Then, in 1994, a law was passed. The law is DSHEA. Dietary Supplement Something. Hindi ko mabisado. So, DSHEA law. DSHEA law. So, ang ginagawa ng DSHEA, ito yung specific law that regulates food supplement. Food supplement is also known as dietary supplement. So, parehas lang yan. Same term. Okay? Okay? So, dyan nag-start mag-regulate. Okay? So, dyan nag-start mag-regulate. So, basically, tinitignan ng FDA under the DSHEA is content, amount, okay, add-ons, nandoon yung no approved therapeutic claim. Okay? As reminder to the buyer na this may help promote health, cure you of any disease. It basically checks for safety. Is it safe enough for human consumption? Okay? Hindi niya to responsibility. Okay? Hindi yung tawag dito, therapeutic effect or potential efficacy ng product, hindi niya yun tinitignan. Okay. Now, nagkaroon ng update. I think around between 2000 to 2007, nagkaroon ng update sa FDA DSHEA. They started the GMP, also known as the good manufacturing process. So the good manufacturing process, from the name itself, ito yung naging standard na kailangang sundin ng lahat ng manufacturer. So in short, kung ikaw ay kumpanya na gagawa ng supplement, lahat ng gumagawa ng supplement kailangan sumusunod sa GMP. Okay? Yung GMP na yan, in-update nila para mas maging mahigpit. Nagkaroon ng update, it became the current GMP or the CGMP. Anong difference? Dati sa GMP, okay, under the GMP system, tatlong type ng product. Food supplement, okay, at saka pharma grade. Okay. So, dalawang quality ng product ang pwede mo manufacture as a manufacturer. It's either your product is a food grade supplement or it's a pharmaceutical grade supplement. So, yung food grade supplement, ang level ng amount ng nutrient dyan, RDA. Yung pharmaceutical grade, ang level ng amount ng supplement, optimal. Yun yung okay? Ang food supplement, ang manufacturing facility is as with any food producer. Ang pharmaceutical grade product, ang manufacturing facility dapat pharmaceutical level. So mas mahigpit, mas mataas ang quality standard. I hope you follow. So yun yung difference. Nung nang-update si MP, na bago yung grading. So, meron ng food grade, okay, nutraceutical or dietary grade, and the pharma grade. Nagkaroon ngayon ng difference. Okay? So, under the current GMP, ang supplement manufacturer, ang product niya below 20%. Basically, ng nutrient na nabibigay mo is at optimal. Okay? Second, you followed all the safety manufacturing process for a pharmaceutical product. Third, napapatunayan mo that pharmaceutical grade, napapatunayan ng company na lahat ng dineclare niya sa label, pag tines, nandoon sa product. Okay. And fourth, nagbibigay na prove ng supporting data niya na yung content ng product niya ay kaya makatulong sa prevention and therapy of nutritional deficiency. Dahil na-achieve lahat yon, okay, nandun na siya sa pharmaceutical level. May efficacy na, may therapeutic claim na, kaya natatanggal yun. Nasundan ako so far? So, the labeling is not for the entire product line. It's for every product. For every supplement product that you submit, it has to go through the process. Okay? So, kaya iba yung naghang ba ako? Okay. Ayun. Akala ko ako yung naghang. Okay. Kaya pag makikita nyo, may sayo sana, may product na may no approved therapeutic claim, may product na wala na. Kasi per product ang submission, per product yan. Okay? So, I hope that helps enlighten everyone. So, ano yung, now, how do we, for a consumer, if you're somebody who's going to buy a supplement, okay, wala ka namang panahon at wala kang interest na aralin yung mga. So, doon ngayon papasok yung research guide. Okay. Okay. Research guide. So, I hope everybody has a copy. So, ito yung research guide natin. So, the research guide is not a publication of USANA. Okay? It's an independent company. The company is NutriSearch. The company is NutriSearch. So, they are a publishing company and their main published material is the NutriSearch guide, Comparative Guide to Nutritional Supplement. The editor is Sir Lyle McWilliam. Okay? Sorry, nagre-reflect yung ilaw natin. So, Sir Lyle McWilliam, siya yung editor. So, hindi sila associated sa USANA. So, a little back history, Mr. Lyle McWilliam used to be a part of the Canadian government, particularly the parang Department of Health ng Canada. So, at the time, during the late 80s to 90s, nagiging rampant yung paggamit ng mga tao ng supplement sa Canada. And when the Canadian government studied these supplements with the help of Lyle McWilliam, they found out that medyo questionable yung quality, safety, and claimed benefits nitong mga supplement brands na to. So, in order to help the public, the consumer, okay, they started studying this different supplement brand para ma-educate ang Canadian citizen na maging aware paano pumili sa supplement na binibili nila. So when Mr. Lyle McWilliam left the Canadian government position, he created a company that is now the NutriSearch. So itong NutriSearch na to is basically they are a research, they are a group of researchers that evaluates the latest data on nutritional science, supplementation, and human health. So what they do is that they review different articles, they publish it, and what they did was they created a guide, a consumer guide. So itong libro na to, hindi to para sa medical practitioners talaga. Ang target nitong libro na to ay consumer, to help guide the consumer what to look for when choosing a supplement. Okay? And dapat lahat ng tao may kopya nito. Or bago ka bumili ng supplement at mag-invest sa supplement na iinumin, maganda talaga mabasa at ma-review mo muna itong libro nito para meron kang scientific, concrete guide paano ka ba mamimili. So, the contents in the NutriSearch Guide is a product of scientific research. Hindi po ito survey. Okay? Research po talaga to. And what they do here is that they look at the different available, particularly in Northern America, and I think they are hopefully going to launch a version for Asia and other areas in the world. But so far, ang ini-evaluate nila dito ay US, Northern America, including US and Canada, Latin America brands and supplement. Okay? So, what they did is they came up with a standard, a scoring system that guides the consumer na ano ba yung brand ng supplement na na-achieve yung tamang level ng nutrient na kailangan mo. And alam mo na talagang nasusuportahan yung health mo pag yun ang iinumin mo. So, eto yung guide na yun. So, yung nakikita nyo na yung nakikita yung table sa guide, na hindi natin makita, masyadong bright. Okay. So, yan. Yung mga table na yan, yung may mga score, yung may mga stars, may ibig sabihin yan. Okay. Na pag binasa nyo, at alam ko hindi nyo pa rin siya binabasa, maintindihan nyo ano yung mga stars na yun. So, yung mga star rating, it's not there to defame or siraan yung mga brands. Yung mga star na yun stands for something. And the star is based on decades and continuous update on research on nutritional science. So, isa-summarize natin what is the process ng NutriSearch Guide. So, ang ginagawa ng NutriSearch is, sundan nyo na lang itong board para ma-summarize natin yung NutriSearch Guide. So, ang ginagawa ng NutriSearch company is that they look at different brands of supplement. Okay? They look at the different brands. Yung particular brand ng supplement na ine-evaluate ng NutriSearch Guide are the brands that have a broad spectrum product. Yung may mga broad spectrum. So for example, sa USANA, ang in-evaluate ni NutriSearch is yung yung multiple nutrient content, which is basically the cell essentials. Yung optimizers, hindi yan kasama sa NutriSearch. Okay? So yung broad spectrum nutrient product, ang tinitignan ng NutriSearch Guide. So they get the list of the different product of each brand. And what they do, they look at the label claims. Okay. Bakit label claims ang tinitignan? Because as a consumer, hawakan pag bumibili tayo ng produkto, kundi ang label. Kaya dapat magbusisi tayo sa label. That is the only basis basically that we have every time we buy something in the market. So, tinitignan ni NutriSearch Guide yung label. So, anong unang tinitignan sa label? amount, the amount or the level ng nutrient. So for example, nakalagay vitamin C, tinitignan ni Nutri-Search ano yung amount. Okay? Ano sa amount ang important? Tinitignan ni Nutri-Search kung lumalagpas ba yung nutrient na yon above the 150% upper limit. Bawat nutrient may tinatawag na upper limit. The upper limit is set because if yung nutrient na yon lumagpas sa upper limit or the allowable limit, it can potentially cause harm. Pag lumalagpas sa upper limit, dyan natin nakikita yung observed adverse effect. Okay? Pag lumalagpas dyan sa 150% ng upper limit, potentially mag-cause ng adverse effect yung nutrient na yun. Okay? So kapag 3 or more ng ingredients ay lumagpas sa upper limit, out. Out na siya sa evaluation ni Nutri-Search Guide. Automatic, hindi na siya safe. And dahil hindi na siya safe, hindi na siya dapat binibigyan, hindi na siya nililista kasi hindi na siya kailangan i-evaluate further kasi doon palang bagsak na siya. Okay? So, yung hindi lumagpas, i-compare niya dun sa dinevelop niya na blended standard. So, pag binuksan niyo yung Nutri-Search Guide, makikita niyo doon yung mahabang table, yung 2 pages ng table. That is the blended standard. This one. Yan. Ay. Ayun. Basta yan. Ayan yung blended standard. Okay? So, ano yung blended standard na yan? Yung blended standard na yan is developed by Nutri-Search. No? Patent nila yan. Silang gumawa niyang table na yan. So, what they did is, they looked at the recommendation and research of 12 nutritional experts in the world. So, according to these 12 experts, ayan yung mga pangalan ng mga experts na yun. Okay. So, according to these nutritional authorities, these are the different nutrients. These are the different nutrients that we need to take every day. Ito yung mga amount na nire-recommend ng bawat researcher, ng bawat expert na yun. And ang ginawa ni Nutri-Search, kinuha niya yung mean average, yung nasa dulo. Okay? So, yung mean average na yun, dun i-compare yung mga pumasa sa upper limit. So, it's now compared to the mean average sa blended standard. Okay? So, ang goal dyan is you want to be as close to the mean average or a little higher. The closer you are to the mean average, the higher you are, like 20% ka of the mean average and up, the more optimal levels are reached. Yung optimal daily allowance, yun yung ine-establish doon. Okay? Okay? So, after i-compare dun sa blended standard, based on the blended standard or the level, ine-establish ngayon yung health support. Ibig sabihin, yung lahat ba ng nutrients na yon sa ganong level, anong kaya niyang suportahan sa katawan? Okay? You follow? So, based on the Nutri-Search Guide, there are 16 may 16 criteria to establish health support. Okay? So, ang gagawin ng Nutri-Search Guide, okay. So, ito lahat ng content nitong product na to. Ito yung amount niya. Okay? Then, bibigyan ni Nutri-Search ng points depending on the level. So, mas maganda yung level niya, mas tumataas yung score niya sa scale. So, ang scale is 0 to 100%. So, scale is parang ruler, di ba? So, let's say, plus, nasa 40 plus yung ingredients niya, aakyat sa scale. Scoring scale. Lumalapit yung amount niya sa ODA, tataas yung scale. So, paano papatataasin yung scale, 0% to 100%, kino-compare din dun sa health support criteria. So, dun sa Nutri-Search Guide, may 16 na support criteria. So, ando dun yung completeness, cardiovascular support, health support, longevity support. So, so, mas nasasagot niya, mas tumataas yung score niya. Okay. Now, watch out. Yung criteria 1 to 14, mas nasasagot yung tanong sa 1 to 14 plus point. Ibig sabihin, mas tumataas yung scale rating niya. Okay? Yung criteria 15 to 16, the more nasasagot niya yung 15 to 16, negative points yun. Penalty. Yan yung nakikita niyong red bar. It's the red bar dun sa horizontal graph. Okay? So, for criteria 1 to 14, ito yung green bar. So, mas nasusuportahan yung 1 to 14, mas humahaba yung green dun sa graph. Okay? Itong 15, 16, ayaw mong makita. You don't want to see red in the health support graph of the product you are taking. Ito yung no-no. Okay? So, based on the blended standard and then the health support, bibigyan ngayon ni Nutri-Search ng final product rating. Ito na yung stars. Ito na yung star system. Okay? So, 2 stars and below, ibig sabihin, mababa yung kanyang health support kasi nutrient content and mababa yung nutrient level. So, less yung support. If you get 4 to 5 stars, sabihin, mas madami yung content, mas marami yung nutrient amount, mas mahaba yung nasusuportahan, and less yung kanyang negative effect, mas mataas yung kanyang score. You follow? Nasundan? I hope nasundan. So ngayon, ang gagawin ni Nutri-Search Guide, etong 4 to 5%, ini-invite niya. They are invited. Invited for what? They are invited into the NMAP. NMAP. NMAP is also known as the Nutri-Search Medal Achievement. Ito na yung bronze, silver, gold, diamond, platinum, and the platinum plus. Okay? So, meron tayong, ulitin ko, there is bronze Medal Achievement Award, silver Medal Achievement Award, gold medal, diamond, platinum, and platinum plus. So, 6. Dati sa old Nutri-Search hanggang gold lang. Okay. Bakit nagbago? Okay. Kasi may dinagdag na classification si Nutri-Search. So, iniimbitahan niyang sumali dun sa NMAP. Invitation yan. So, the company may join or not. Okay. So, ano ang hinihingi ni Nutri-Search sa NMAP program? Pag ikaw ay 4-star or 5-star company, you agree to participate, Nutri-Search requires you to submit certification that will prove quality, safety, both ng manufacturing and final product. So, kailangan mag-submit ng manufacturer ng certification. Okay? Ngayon, yung gastos ng manufacturer. So yung NMAP program, this is basically the challenge of NutriSearch Guide to the company. Your mouth is, kumbaga, patunayan mo yung claim mo. Kung talagang wala kang tinatago, confident ka sa quality ng product mo, alam mo na yung claim, yung lahat ng nasa label mo is 100%, kaya mong i-prove sa product mo, patunayan mo research. So, gastos yan ng kumpanya. Hindi yan gastos ni NutriSearch. And this certification cost millions of dollars to achieve. Hindi yan 100 pesos lang na certification. Mahal yung mga certification na yan kasi kailangan mong bayaran yung mga agency na yon, independent agency in that. So, gusto ma-check yung quality ng manufacturing and yung quality ng final product. Dalawa yung chine-check. Okay? Okay. So, sa manufacturing, kailangan yung GMP certification. Good manufacturing certification. So, ang tinitignan dyan, are you following food, GMP? Are you following Nutra or dietary supplement, GMP? Or are you following pharma? Yun yung tinutignan sa manufacturing. So, ang nag-a-assess niyan is basically the FDA. NSF does that as well. PGA can do that as well. So, you can read on further in the NutriSearch Guide and yung mga agencies na gumagawa niyan. And then, sa final product, ang tinitignan dyan, ini-establish kung ganun din, food grade lang. Manufacturing facility is pharmaceutical grade. Pharma. Yung manufacturing process natin, pati yung manufacturing facility natin is certified pharmaceutical. So, meaning, USANA is a company that can produce not only supplement and food product, it can only produce pharmaceutical grade product like pharma grade supplement and pharma drugs kung gugustuhin niya. Okay, so that's one. Pharma grade manufacturing facility. And yung isa pa natin na-establish is, meron tayong in-house laboratory testing facility. Yung ability mo mag-provide ng sarili mong laboratory is what makes you Platinum Plus. Ano ibig sabihin nun? Kasi pag meron kang in-house, state-of-the-art laboratory testing, let's say, dumating si FDA sa USANA, o kaya dumating si NSF, o kaya dumating si Consumer Lab, and then i-challenge niya yung mga product na lumalabas, okay? Pwede siyang kumuha doon at random, at i-challenge niya si USANA, okay? I want this product tested. Can you prove to me that this is what you claim? So, gagawin ni USANA, kaysa ipadala niya sa labas, pwede niyang dalhin dun sa sarili niyang lab mismo. And yung lab ni USANA is acknowledged and certified as a lab that is equipped to test pharmaceutical grading of a product. So right then and there on the spot, pag challenge niya, kaya niyang patunayan. And ginagawa niya yung testing na yon daily. So meron siyang daily auditing and evaluation of product quality. Yun ang na-establish ni USANA, kaya niya nakuha yung Platinum Plus. Kuha? Yes? So that's how you use the NutriSearch Guide. So how do you apply the NutriSearch Guide when you're talking about, when you're comparing supplements with your client? Okay. So let's say yung client mo sabihin niya, oh, I'm interested to take supplements, but I don't know how to start. How do I know if the supplement is good and safe for me? So usually ako sabihin ko dun sa mga friends ko, alam mo, you can get this book. I was able to buy this book na to sa National Bookstore. Maganda siyang guide para malaman mo how to choose. And then my friends would ask, okay, ano yung guide na yun? So I send them the picture or a link. It's a Nutri-Search. And then pag binasa nila, sabihin nila sa akin, Tay, ang complicated naman ng libro eh. Ano ba ibig sabihin ng libro? Sabihin ko sa kanila, tignan mo sa likod. Nakita mo sa likod, may mga stars. May mga stars. Okay. So yung mga stars na yan, may ibig sabihin yan. So mas madami kang star na makita. Number one, mas kumpleto yung nutrient na makukuha mo dun sa supplement na yun. Okay. Pangalawa, dahil yung nutrients na yun ay mas madami at na-achieve niya yung required ng katawan mo, mas maraming suporta na pwede ibigay. So, pwede niyang suportahan immune system mo, bones mo, heart health mo. Di ba na sabi mo sa akin, ang concern mo, heart, dahil si mami mo may heart problem. Hanapin mo yung mga supplement na may mga star. Mas maraming star, mas kaya kang suportahan. Okay. Then sabi niya, okay, yun pala yun. So, hanapin niya, uy, nakita ko dito, di ba, yung sana yung iniinom mo? Oo, nakita ko dito 5-star siya. Di maganda pala siya? Yes, maganda siya. Kasi according dyan sa guide na yan, kinumpare nila and ana-analyze nila na yan talaga yung kaya niyang gawin. Okay. So, paano ko pa malalaman na safe to? How do you know that it's safe? Tignan mo yung medal. Bawat product may medal. Okay. Yung mga highest rated product dyan, medal. Basta 5-star may medal. Tignan mo kung ano yung medal niya. Siyo sana nakalagay dito, Platinum Plus yung medal niya. Ano ibig sabihin ng Platinum Plus? Pag sinabing Platinum Plus, pumasa siya as pharmaceutical product. Pwede bang pharma ang supplement? Yes, pwede. Yan yung hindi alam ng karamihan. May bago ng standards pagdating sa supplement. May iba-iba ng klase. And the highest is pharmaceutical. Meaning, kung ano yung in-apply na strict control and quality check sa gamot, ina-apply na yun. And alam mo ba, sa buong mundo, 3% lang ng supplement ban ang pharma. And ang swerte natin, kasi sa Pilipinas, merong pharma supplement. And that is USANA product, particularly yung Celsensius. Yun pala yun. Uso ng Enervon. Pharma ba siya? Unfortunately, hindi siya pharma. Siya ay yung tinatawag na food grade supplement. Pharmaceutical yung company, pero yung product, hindi. May pagkakaiba pala yun. Oo. Kasi pag bumibili ka ng supplement, kailangan mo din tignan company at product. Pwedeng ang kumpanya, pharma, ang supplement product, food grade. Ang food grade na company, hindi makakagawa ng pharma na product. Pharma company lang ang pwedeng gumawa ng pharma product. Pero hindi lahat ng pharma company gumagawa ng pharma product kasi mahal gumawa ng pharma product. It takes commitment for a company to produce a pharma quality product. That's how I explain to people. But kasi pag naintindihan mo, di ba nasasagot yung mga tanong? Pag nasasagot natin yung mga tanong nila, tumataas yung confidence level nila na alamin. And dahil nalalaman nila, nagiging pihikan. And dahil yung ina-explain natin is it's backed up, invento. Pwede nilang i-verify yung ina-explain mo sa kanila. Ang maganda nun, hindi natin to publish. Independent to. Wala tayong nakukuha dito, hindi natin sila binabayaran. They're just doing their job of educating the public on how to take the right nutritional supplement because the take matters in your health. It matters a lot. Okay? So, with this guide, now we know what is the highest rated 5-star, best of the best supplement in the world. And that is currently the USANA Health Sciences. So, in summary, we will now summarize what makes USANA different from the rest according to the Nutri-Search Guide, according to the TGA, the FDA, the NSF, the consumerlab.com, kasi sila yung mga nag-e-evaluate. We are not the ones saying it, they're the one telling it to people. Sila ang nagsasabi para sa atin. So we'll summarize that. Did you get this? May screenshot kayo, screenshot nyo na lang. Yung mga nakafollow. Okay? So, I'll erase the board. Alam niyo na yung Platinum Plus ha. So basically, sa Platinum Plus, ang key doon is yung manufacturing facility, yung company, pharma ang manufacturing, in-house manufacturing facility, walang ibang gumagawa ng product, controlled niya. About 95% dapat controlled niya yung manufacturing. Next is meron siyang in-house laboratory testing to test quality and safety of the product at any given time. Okay? So, yun yung important. USANA difference. What makes USANA a standout product and company in the industry of nutritional supplementation? Okay. Most importantly, USANA is founded by a scientist. USANA is founded by a scientist, not just any scientist. Dr. Myron Wentz is a scientist recognized in the world of nutritional science, in medicine. No? He is a scientist with a double degree, di ba? Alam na natin yan. Double PhD siya. And he is known as the one who highlighted the need for antioxidant in daily supplementation. That's why USANA Health Sciences is also known as the antioxidant company. Kasi siya yung nagpakita ng benefit of adding antioxidant sa supplement intake. Okay? So, Dr. Myron Wentz, yung vision niya napaka-powerful. No? A world free, the USANA family will be the healthiest family on earth. Yun yung commitment, vision, and mission niya and ng company na in-establish niya. So, because the company is founded by a scientist, USANA is really focused on science-based research. Everything that USANA does is all about science. No? Science. From manufacturing, through the raw material, to the processes, to the end product, lahat yan science-based. Alam niyo ba na pati yung mga bottle at label na ginagamit sa product natin are science-based? So lahat yan, aral. Okay? USANA boasts advanced research and development. We have an advanced R&D department. We are a company with the highest number of nutritional scientists, cellular experts, anti-aging experts. We even have our own department dedicated to studying the human microbiome and microbiome nutrition. Okay? We are also delving into traditional Chinese medicine, the benefits of herbal nutrition, inaaral din yan ni USANA para ma-incorporate sa mga development ng product natin. And because of this advanced research in development, USANA has invented innovative and groundbreaking technology. Kasama dyan yung mga patents niya. Because of that technology, USANA was able to create 11 patents. May 11 patent-protected technology na inimbento si USANA. Kasama po dyan ang olive oil, the hybrid technology, the self-preserving technology, and the current intelligence technology. Those are technologies licensed and patent exclusively to USANA Health Sciences. So, ang ganda ng track record natin pagdating dyan. Okay? And because of this, USANA is able to create a state-of-the-art manufacturing facility that is recognized and registered by the FDA as a pharmaceutical manufacturing facility. So ang ginagamit nating process sa manufacturing is pharmaceutical GMP. That is the grade, the quality of our manufacturing process. Add on to this is USANA has invested in an in-house laboratory. A state-of-the-art laboratory that costs millions of dollars. Why did USANA do this? In order to make sure that at any time a product is challenged, the quality and the safety is easily tested and proven. And every 15 minutes, USANA is capable of spot checking yung mga final product at random. Dahil meron tayong lab na ganyan. And that lab allows us to establish our pharmaceutical graded product. Meaning, napapakita na kaya nating i-check ang identity, composition, potency, purity, safety of the product at any time that it's challenged or asked. No? Pwedeng matignan. Okay? And because of all this, we have 100%, we can establish the 100% guaranteed potency seal. I love the 100% potency guaranteed seal because that shows confidence. That shows honesty of the company and that establishes trust. No? Wala kasi tayong ibang pinanghahawakan pagdating sa supplement product, kundi label. Okay? And hindi gobyerno ang nag-establish ng safety, mismong kumpanya. Kung honest yung company, okay, at talagang gusto niyang makatulong, i-declare niya. Eh, paano kung hindi? You're not the product that you are the what's in the label, is it really what you get? Yun yung gusto natin laging matanong. And because of its potency, we are guaranteed that is safe, the highest quality, and ang maganda pa niyan, because of its pharmaceutical grading, some of its products are pharmaceutical graded and it has established its efficacy when it comes to prevention and treatment of nutritional deficiencies. Okay? So the potency guaranteed seal, nakikita niyo yan, ayan yung seal sa bawat product ni USANA na may pirma ni Dr. Myron Menz. Yung signature niya, ay, kunwari, ano dyan, yung signature niya, di ba? W, nakapirma. So, can you imagine, ganun ka-confident yung founder na nakalagay yung kanyang signature sa guaranteed seal. So, siya mismo, ginaguarantee niya na bawat product na nakakarating sa'yo ay pasado sa strictest and most stringent testing that a product can be subjected to. So the potency guaranteed seal tells you 6 things. Anim na bagay. Strength. Pag nakikita nyo yung potency seal na yan, guaranteed seal na yan, it guarantees you that the content of the product was tested for strength, tested for composition, identity is established, purity, potency, and quality. This is what the 100% guaranteed stands for. Ibig sabihin, yung product na yon ay na-test hindi lang sa lab ni USANA, kundi ng independent lab like PGA, NSF, consumerlab.com, and it certifies that product for quality, for strength, for composition, for identity, for purity, and for potency. Okay? So that is the USANA difference, the highest quality product in the world, di ba? And dahil dyan, we are awarded the 5-star, Platinum Plus, highest rated, best of the best, di ba? We are athlete guaranteed, trusted by athletes, and recommended by trusted doctors and partner companies of USANA, including the Dr. Osho. So we are of the Dr. Osho. The only supplement company partner of Dr. Osho. Wala na siyang ibang sponsor partner na supplement company doon. USANA lang. Okay? So I hope this enlightened you. So again, no, yung goal natin, which is our longevity, meaning longer lifespan, quality health span, healthy aging, it's already built in with us. No? The key is lifestyle and particularly your nutrition. These nutrients can be supplied through supplementation, but when it comes to supplementation, you really have to be aware because it's buyer beware. Label claims are very, very important to validate and verify. The FDA, the government, basically just only looks at safety, no? Meaning walang nakaka-direct harm, walang nakakalason, pwede na yan i-market, pero hindi pwedeng i-claim na nakakatulong kasi hindi na nga nila tinitest further. So in order to really know, is this product quality safe and efficacious for you, you have to check for other agencies, yung mga third-party agencies like Consumer Lab, who publishes their results and ang maganda niyan, may napakagandang company which is the NutriSearch who came up with a consumer guide to help now we know how to explain and guide people. So I hope you use this and guide people. So I hope you use this well, especially in your presentations, no? Presentation, hindi kailangan sobrang haba. Ang importante, masagot nyo yung tanong, quality ba yan, safe ba yan, effective ba yan, tested ba yan, and so for our next module, module 4, we will be discussing the USANA nutritional system, highlighting the essentials and the optimizer. So don't miss that. That will be next Thursday. So now I turn you over to our host, Coach Nixie. You're welcome, everybody. Ay, sorry.